Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mrs. Alia. May I know what brings you here today? Mm-hmm. Okay. Mm-hmm. Tell me more. I'm very sorry to hear about that, Mrs. Alia, and I understand that being parent, how a difficult situation would be for you. So, Mrs. Alia, to better understand Ali's condition, I need to ask you a few questions regarding condition and I need to examine him if Ali is accompanying you today. Mm-hmm. All right, Mrs. Alia, it would have been better if he could accompany you so that I could have examined him. But it's okay, I'll ask questions. Is it okay with you? Mm-hmm. Right, Mrs. Alia. So, may I know the exact age of Ali? Okay, 5 months. Okay, so when does he cry? Mm-hmm. Okay, can he be consoled? Mm-hmm. Okay, and what do you do when he starts to crying? Okay, if there is any feeding problem, if he is feeding properly. Mm-hmm. All right. If he has any fever along with that, any neck stiffness, any rash on body, any rash on his nappy area. Mm-hmm. How about his skin color? If his color is pale, have you noticed that he feels tiredness while taking feed? Okay. If there is any eye discharge, if he had any trauma, or if any history of fall. All right. Is he having some nasal blockage? Have you noticed that he's pulling his ear? Or any discharge coming from his ear? Is he coughing? Have you noticed any difficulty in breathing? Mm-hmm. All right. If he vomits after feeding? Mm-hmm. Okay. If vomiting is mild or projectile? Mm-hmm. Okay. And how often does you feed him per day? And what type of milk? If he is on breastfeeding formula, next, okay. And how much fluids does he drink? Okay, and how long does feeding typically take? Mm-hmm. Okay. All right, Mrs. Alia. So how about his bowel habits? Is he passing his stools normally? May I know the consistency? Mm-hmm. Okay. Mrs. Alia, if you have noticed that he is passing currant jelly like a stool, and notice any swelling on his genitalia? Mm-hmm. All right, Mrs. Alia, may I know what was the mode of delivery? If he is a first child? Mm-hmm. If any complication during pregnancy or during labor? Mm-hmm. If his vaccination is up to date according to schedule? All right, Mrs. Alia, did he receive an immunization recently? Mm-hmm. When was he given last vaccination? Mm-hmm. Okay. If there is any swelling at the atavia or any redness? All right. All right. So, Mrs. Alia, as you stated that he is on mixed, you are breastfeeding and on formula. Are you preparing formula milk according to set principles? May I know how you are diluting? All right, Mrs. Alia, can he raise his head while lying on chest? Is there any medical problem, asthma, diabetes, any surgical history? If he's on a medication, if he has any allergies, if there is any immediate family member suffering from same has any medical problem, major medical problem. All right, Mrs. Alia, so how is crying has affected you? I'm very sorry to hear about that, Mrs. Alia. I understand that as it is your first child, so it would have been difficult for you to cope with all. Okay, but you need not to be worried. I'm here to the best of my abilities, okay, and to solve your problem, if it makes sense to you, Mrs. Alia. So what do you think is the cause of his crying? Yes, Mrs. Alia, I would like to examine him, but it's okay. Please bring him along with you next time. Is it okay with you? So, Mrs. Alia, the history you have shared with me, okay, the questions I have asked, okay, I came to the conclusion that he's having excessive crying due to recent immunization, okay. But you need not to be worried, Mrs. Alia. I'll explain everything to you, okay. So, first of all, I'll encourage you to take good care of him, okay, and I'll teach you formula milk dilation, okay, as you were over dilating, okay, and so actually dilution is 1:1 dilution, okay. If you are using 1 ounce water, okay, 1 tablespoon of milk, okay, if because 1 ounce is equal to 30 ml, okay. So if you are using 2 ounce, okay, 2 tablespoons of milk, then use 60 ml, okay. For 1 spoon of milk, 30 ml, for 2 tablespoons, 60, and so on, okay. So 3 tablespoons of milk, then 90 ml of water, if it makes sense to you, Mrs. Alia. Should I repeat it again for you? All right, Mrs. Alia, and besides that, I'll advise you that give feed on time, okay, if he's hungry, okay, and if he wet, change nappy and apply nappy rash cream, okay, and maintain pamper-free period, okay, and as he has immunization recently, okay, even though he has mild fever, okay, but he has been crying due to pain at injection site, okay. So for that, I'm prescribing syrup, paracetamol, okay, 125 mg per ml, okay, and you have to give him 3 times a day for 3 days, okay, and along with that, I'll encourage you to apply ice at injection site, okay. And give plenty of fillers, okay. Is everything clear till now? Is there anything else you want to discuss with me today? All right, Mrs. Alia, here is a leaflet. It includes all the information regarding his condition. Okay, I hope it will be helpful for you. I wish him healthy life. Okay, take care. Bye-bye.